Hi, I'm Anna and I'm in Advanced Health Assessment, and this is the Abdominal Assessment video. So this is my patient Steve. He is a 31-year-old male who is in the office today with abdominal pain. So when someone comes in with abdominal pain, you want them to lift their shirt enough for you to see their whole abdominal wall, or in this case we just went ahead and removed his shirt. So we're going to observe the abdomen for color, any distension, surface motion, and what venous return patterns that we have going on. I'm now going to have the patient lift his head off the pillow, and here we're checking for any muscle separation, any masses, any hernias, of which I do not see. So you can lay back down. We're now going to auscultate. We'll auscultate in all 4 quadrants. If need be, you can auscultate for up to 5 minutes in each quadrant. And we want to hear the bowel sounds and the frequency. Okay, bowel sounds were heard in all 4 quadrants with normal active frequency. We're now going to auscultate the arteries and listen for any bruits. You're going to listen with the bell of the stethoscope on this. So we'll go ahead and start with the aortic. Go down to the renal. The iliac, and the femoral. And no bruits were heard. We're going to go on to percussion. We want to differentiate between tympany and dullness, and we can check first for the liver size by starting at the right midclavicular line. We're going to mark where we heard both of those, and then measure. The liver size should be between 6 and 12 centimeters. And his was 9.5, so that is normal. Next, we'll go ahead and percuss the spleen. It should be on the mid-axillary left line, usually between the 6th and the 9th rib. And you should hear dullness. Okay, right here. Next, we'll go ahead and percuss the gastric bubble, left lower anterior rib cage and the left epigastric region. And you can listen for dullness, which is here on this patient. Next, we'll go into light palpation. When you do light palpation, you want to start out with that just to assess for muscle resistance, tenderness, and any masses, especially when the patient is reporting in pain. You don't want to throw them into too much pain. Do you have any pain with that?
No.
Okay. And I do not feel any resistance or masses. From light palpation, you'll go into deep palpation. You can start at the umbilical ring, usually soft in the center, and you don't want to note any bulges, hernias, nodules, or granulation. That's normal. Next, going to palpate the liver. So put my left hand behind and going to push up the liver. Have the patient take a deep breath. Okay. And that was not palpable. Usually it's not. But if so, you want the liver to have a firm, smooth, even, and non-tender edge. Next, we'll go ahead and, we could go ahead and palpate the gallbladder, but usually it's not felt. If it is, then you can suspect cholecystitis, and it would be below the liver margin at lateral border of the rectus abdominis muscle. so over around here. We'll now go ahead and palpate the spleen. So I'll reach over with my left hand and with my right hand on top at the left costal margin. We're going to put my fingertips in, ask the patient to take a deep breath. Okay, and that was not palpable, which is a normal finding. We'll go ahead on to the kidneys. The left kidney is usually non-palpable, but we'll go ahead and show you. Take a deep breath. Okay, and that was not palpable. We'll move on to the right. Okay. Okay, and I did feel a lower pull with the right. It should be smooth, firm, non-tender, and rounded, and those are the findings that I found. We'll next go ahead and palpate the aorta, the left of midline, and feel for aortic pulsation and determine the direction. Okay, and then next and lastly, we'll have the patient sit up. We're going to percuss for CVA tenderness.
Nope. Nope.
Okay, and that concludes a abdominal assessment.